Good morning and welcome to the Howard University. A moonshot in a technology context is an ambitious, exploratory, and groundbreaking project or undertaking. When President Obama called on Vice President Biden during his 2016 State of the Union address to lead a new national moonshot initiative to eliminate cancer as we know it, and the project was jump-started in February of this year. When the White House announced a new $1 billion initiative, it became evident that the Obama administration was committed to supporting the essence of American innovation to identify new ways to prevent, diagnose, and treat cancer. It is a similar spirit of innovation that encouraged the founding of this Howard University and of its Howard University Cancer Center almost a half-century ago. The mission of the Howard University Cancer Center is to reduce the burden of cancer through research, education, and service with an emphasis on the unique ethnic and cultural aspects of minority and underserved populations. The focal point of my research is to narrow the disparity in cancer outcomes between African Americans and the larger population. I am inspired by the Obama administration and especially Vice President Biden's investment to support cutting-edge research. I have a deeply personal relationship with Howard University, and so I was very humbled when the opportunity to become its 17th president occurred. My work as a surgical oncologist, however, is still the most gratifying work that I do. My mentor, Dr. Sal Lafall, once said, "We should always grant patients hope, because when you grant them hope, you grant them one of the greatest of all human joys, and that's the joy of anticipation. That perhaps, just maybe, there is something that can be done to help them." In order to provide an environment that continuously cultivates highly competitive researchers, faculty, staff, and students, Howard University is working to establish a Master's in Public Health program next fall. This program will highlight the importance of comprehensive healthcare initiatives in order to find a cure for cancer as aggressively as it attacks human bodies. We must prepare practitioners who understand public health, healthcare policy, health communications, advocacy, education, administration, treatment, and disease prevention. So I am extremely honored and humbled that this summit that represents one of the most important public components of the Moonshot Initiative is being hosted at my alma mater here on the campus of Howard University. Vice President Biden, we thank you for your dedication and personal connection to this research and look forward to future collaborations to support this initiative. Thank you.
Ladies and gentlemen, please welcome Carol Burnett.
Good morning. Welcome. My heart soared when I saw President Obama during his State of the Union address ask Vice President Biden to lead the cancer moonshot. So I sat down and I wrote Vice President Biden a letter asking him if I could do anything to help. I wanted to volunteer. As a result, I'm thrilled to be here today. Unfortunately, the Vice President and I share a common bond. I lost my daughter, Carrie Hamilton, to cancer 14 years ago. She was 38 years old. She had a passion for life, and I might add, she had a great sense of humor. There was a time just when she was in and out of the hospital quite often during the last few months. And so this one night I got the call that she had been readmitted. So I drove to the hospital and I walked into the room. It was about 3 o'clock in the morning and I just sat by her bed. She was asleep, and then she kind of opened her eyes, and I made this kind of stupid off-the-cuff joke I thought was funny, or, anyway. And I said, yeah, Carrie, so you had to come back and be in the hospital again, huh? And she, without missing a beat, she said, well, I miss the food. That's who she was. And then I was leaving, and a nurse, one of the floor nurses, came up to me, and she said, I have to talk to you, tell you something about your daughter. And I said, what? And she said, well, Carrie, when we come into the room in the morning and everything, and there she is, bald-headed from the chemo and lying there in bed, she cheers us up. And I asked her, I said, Carrie, how can you always be so cheerful? And she said, every day I wake up and decide, and this is the key word, every day I wake up and decide, today I'm going to love my life. Well, she loved her life right to the end. And I have to say, today is remarkable for many, many reasons. This Cancer Moonshot Summit is the first of its kind, and across the country in all 50 states, summits like this one are taking place. At 270 regional summits in all 50 states, including DC, Puerto Rico, and Guam, over 6,000 people, researchers, hospitals, foundations have come together to share any and all information about cancer. So today is remarkable for many reasons, none the least of which is hope. Hope means many different things to different people, but to a cancer patient and the family affected by it, hope means everything. Today we'll see in this room and at summits all over the country that we have every reason to hope. As a parent who lost my Carrie to cancer, I've always felt that Joe Biden was in my corner. Like so many of you, I'm inspired by his vision and determination. He's what the Cancer Moonshot effort is all about. He knows cancer. He lived through cancer. And he sees that if we fight it together, we can have a world without cancer as we know it. I'm with you, Vice President Biden. We all are. Ladies and gentlemen, without further ado, the Vice President of the United States.
Thank you very much, Carol. Please, thank you. Please. Please, thank you so much. Mr. President, let me thank you by offering Howard as a venue. This is an important meeting. Before I go through the introductions and the recognitions of people, Carol came into my office yesterday, and it was like we'd known each other forever. Although I've watched her, I felt like I know her. But like many of the survivors that are in this room or patient advocates, the stories of our children and our spouses and our brothers and our sisters who have not, who fought the good fight and ultimately succumbed. It's amazing the spirit of so many of them. She was telling me about Carrie, and I started talking about, and I will not do this, I promise, about Bo, my son. And I was thinking when she was speaking that he was at 3 different hospitals over a year and a half. By the way, if there are any angels in heaven, they are all nurses. You docs are okay, but they're all nurses. Male and female. You're looking at a guy 2 months in ICU, 2 cranial aneurysm, an embolism. I tell you what, doctor, I used to love it, Stacy, when I'd be in ICU and be looking at all those, all the machines, and you knew that if it flatlined, you had a problem, and you just get tired. You're not in pain, you just get tired and say, I just want to, and next thing I know, the nurse in the ICU, the doctor would come in and say, doctor, here's what we have to do for the patient, and they'd listen to the doctor, yes, doc, right, okay. He'd leave, and then they'd do what they thought was right. At any rate, what I was thinking about, Carol, is that I believe almost every nurse in a 2-year period who took care of Bo showed up and waited as long as 5 hours in line in Wilmington, Delaware to be at his viewing and his funeral, which is a hell of a testament to the nurses, but also a testament to our children. Carol has taken her celebrity and focused it on this fight for a long, long time. And I don't think any of us can thank her enough. Like many of you in this audience, you've given your time and your passion and your emotion and your money to deal with this god-awful problem. Dr. Frederick, again, thank you for hosting this summit, for your leadership. Not only is this a great university, but in the medical field, it's in the fight against cancer. You're part of this whole gigantic effort. And excuse, as we used to say in the Senate, a point of personal privilege. One of the executive vice presidents at the DuPont company, who I came up with kind of as a kid when I was a young guy, and he did much better than I did, though. Stacy Mobley here, who is now, I think you're chairman of the board down here, Stacy, and it's good to see you. And I haven't seen you in a long, long time. But everything that is ever important or good at home, you were always there. And obviously you haven't changed your stripes in retirement. Let me thank everyone for being here. I want to thank everyone gathered at more than 260 summit sites in all 50 states, Puerto Rico, Guam, and here in D.C., from Miami, Florida, to Anchorage, Alaska, from Milwaukee, Wisconsin, to Lexington, Kentucky, to Hastings, Nebraska, to my hometown of Wilmington, Delaware. Summits are being hosted, serious undertakings. The Department of Health and Human Services, the American Lung Association, the Phoenix Children's Hospital, so many others are hosting summits all across the nation. This is the first time I believe, I'm told it is, the first time that physicians, scientists, nurses, patient advocates, families, and cancer survivors, foundations, companies, institutions have all come together at one time in such extremely large numbers throughout the country to simultaneously begin to decide what changes do we have to make, if any, in this fight. All across the country, all under a national charge from the White House to do something big, but very possible. Make a decade's worth of progress in the next 5 years. I know when Moonshot was first announced, some said, well, Biden's being naive, ending cancer in our time. That's not what I said. I believe we can make exponential progress exponential progress. I firmly believe we can do in the next 5 years what would ordinarily take 10. And think of what that will mean. Think of how many people you know who are saying, you docs who are saying, Doc, I just want to make it one more month to see my daughter get married. Doc, if I can just make it, if I can make it another 4 months, I'll be able to pay off the house and my wife will be okay when I go. Doc, all I want to do is see my daughter graduate. These are real life things. Time matters. Days matter. Minutes matter. There's nothing antiseptic about any of this. You all know that. We know the problem. Right now, there are 14 million new cases a year in the world, 8.2 million cancer-related deaths worldwide per year. The projections are, by 2025, if we stay in the exact course we're on now, making the progress we're making now, there will be 20 million new cases a year and 11.4 million deaths from cancer alone. Again, this is preaching to the choir, but unlike other diseases, you all know there are over 200 distinct types of cancer that we've identified, which makes cancer far more complicated, a far more complicated disease to treat and to understand. Cancer is taking loved ones from us and robbing us of decades of their lives. And when I announced the decision to not run for president, by the way, I learned if you want to become a really popular elected official, announce you're not running for president. It's amazing what's happened. If I'd known this, I would have announced every year I wasn't running. But after Bo passed, Jill and I concluded we could. Anyway, I said in the announcement, because I was expected to make a formal announcement one way or another, I said that, and it wasn't written on the page, it was spontaneous. I said that my regret is if I could do anything, I would have wanted to be the president who ended cancer as we know it, because I think it's possible. You know, my mom had an expression, used to say, a little bit of knowledge is a dangerous thing. Anytime your loved one, someone you care about, someone who's part of your soul, part of who you are, is in trouble, all of you do the same exact thing. You try to learn as much about the thing causing that person the trouble. You try to learn as much as you can. And I had some great tutors, the great hospitals that we were in, MD Anderson, Jefferson, Walter Reed. I mean, I had great tutors. And that cancer moonshot grew out of a sentiment that I acquired, that we're on the cusp of an awful lot of change. In the United States, after I made that statement, it wasn't planned. It was shortly after the State of the Union, and the President didn't even tell me, but he announced at the State of the Union that Biden's doing a moonshot. When I first heard it, I thought he wanted me to get in a capsule and head to the moon, but he's one of my best friends. But look, he asked me to lead this effort. But he didn't just ask me to lead it, he gave me authority, like he did in the Recovery Act, authority over all the cabinet positions, as if he were doing it, to engage the entire federal government, every cabinet agency that has any impact, possible impact in the fight against cancer. From outfits like NIH, which you'd immediately associate with, to the Department of Energy. And I've traveled the country and the world, touching many of the major nerve centers in the fight against cancer, to get the ideas of the experts. Is it possible? Can we double the rate at which we make progress? By the way, regardless of where I am, I do an awful lot of foreign policy. You know, that old joke, I'm referred to as a foreign policy expert. An expert's anyone from out of town with a briefcase. I did not bring my briefcase. But I must admit I know a hell of a lot more about foreign policy than I do or did, particularly at the beginning, about the fight against cancer. I was recently in the Middle East talking about ISIS in the Gulf with one of the leaders. And I thought we were going to have this long discussion. I brought my entire foreign policy team, my national security advisor. He had his whole team sit on his beautiful dock outside at one of these palaces. And he starts off and he said, "Can we talk about cancer? Can we talk about cancer?" When I was in Jordan, when I was in Israel, Japan, South Korea, we're working on MOUs with each one of those countries because they want to be part of this effort. I've been stunned at the response to the President's announcement. Just evidence, nothing about me or the President, it's about the intensity with which people feel about this subject and the overwhelming desire to have some concrete hope of additional changes. And everywhere I go, when I talk about what's possible in fighting cancer, there's a consensus that we've reached an inflection point. We've reached let me explain what I mean by that. 5 years ago, 6 years ago, oncologists weren't routinely working with immunologists, virologists, geneticists, chemical engineers, biological engineers. But now they are. Secondly, there is a recognition that by aggregating and sharing data of millions of patients, including genomics, family history, lifestyle, treatment outcomes, we have the potential to find new patterns and causes and successfully treat cancer in ways we never did before. We can now do 1,000 billion calculations per second. It changes the world, potentially, is the what? With aggregated data we can learn. Now we have the capability to do it. Advanced technology, the supercomputing, allow us to analyze enormous amounts of data, to find answers that we couldn't do 5 years ago. It would take scores and scores and scores of experts, years poring over, to find similar patterns. And there's new hope. New treatment like immunotherapies, training the immune system to track cancer cells, more accurate radiation therapies which target cancer cells but do less damage to the healthy cells, transforming many of the types of cancer into chronic and manageable diseases, when 10 years ago they were literally a death sentence. But in my view, to seize the moment, to seize this inflection point, we have to improve how we work together and get this all within our reach. One of the biggest problems we have, in my view, to solve is treatments need to be affordable. We need a strong continuum of generating and using knowledge to fight cancer, and we have to change the entire path, in my view, of how knowledge goes from small labs to pharmaceutical companies to production facilities. And the costs of life-saving drugs are astronomical. We have to come up with a better way. What is the possible justification when a life-saving drug is brought to market? At the time it's brought to market, it cost $26,000 a year. And 15 years later, it cost $120,000. Tell me, what is the justification for that? I'm sure you can identify a lot of other examples. And I know there are hundreds of millions and billions of dollars in sunken costs that reveal that actually come up with nothing. They have to be accounted for. But I want to raise some questions here, and I hope we get some answers. When I began the Moonshot effort, I was committed to bringing together all the human, financial, and knowledge resources we have to break down silos, to seize the moment, and to double our rate of progress. But I'm also committed to doing everything in my power to change the culture that too often stifles that project. Quite frankly, we have to change the culture a little bit, in my humble opinion. There was a report in Stat News that although NIH funding for cancer trials requires the funding, when you get the funding, requires the results of that data be reported instantly, the number of institutions that receive the most funding from NIH funding don't report back to NIH in a timely fashion, sometimes a year or more. NIH scientists themselves, 75% of the time, are late or don't report their results. That's the study. I may be wrong, and I hope the experts here will tell me that's incorrect. But under the law, it says you must report. If you don't report, the law says you shouldn't get any funding. Doc, I'm going to find out whether it's true, and if it's true, I'm going to cut funding. That's a promise. That's a promise. Because all it does is slow progress. And to change the culture, the moonshot effort is guided by a few missions. We have to reclaim the incentive for research within the research system, promote breakthroughs and faster progress preventing and treating cancer. We have to change the culture of research that turns scientists into grant writers, discouraging risk-taking. We have to change our academic and publication system, reward teamwork and results for patients, not just raw numbers of publications and awards that are granted. And by the way, I said this to 6,000 researchers, hosted by an organization in one of the other cities. And I noticed the heads of the organization were a little bit dismayed when 2/3 of the audience stood up and clapped. Not a joke. We need to be sure that research results are available as soon as they are published so the field can move forward. We have to generate and share, secondly, generate, share, and integrate data with the ultimate goal of enhancing patient care. We have to create better systems to share data and to empower patients to share and use their data in the way they want to. In other sectors like physics and aerospace, scientists share complex information seamlessly and ubiquitously all the time. But somehow, I guess for its hundreds of years of tradition, not in medicine. Maybe there's an explanation. I haven't heard it yet. I haven't heard it yet. We have to bring new prevention strategies and diagnostics and therapeutics to patient communities across the world. The first place I'm going after this summit tomorrow is to Cleveland to highlight a tobacco cessation and cancer screening program, a collaboration between George Washington University and Case Comprehensive Cancer Center at Case Western Reserve University. Both Washington and Cleveland have higher than national average smoking rates. Lung cancer rates are higher, especially in areas where few people have access to lung cancer screening. This problem, which we'll hear more about this morning, uses social media and digital monitoring technologies to help people adapt to healthier lifestyles. You all know the numbers better than I do. Prevention can save a whole hell of a lot more lives than anything else we could do. Other screening programs are becoming available that can help detect cancer early so that it can be treated with better chance of success. These new approaches include non-invasive and mobile imaging techniques, new genetic markers that allow us to identify those at risk developing cancers long before they develop. I've been to most every major cancer institution in the country, and some of the work you're doing is absolutely mind-blowing. Liquid biopsies. Liquid biopsies are getting a whole lot of attention and may provide an even better way to screen for cancer very early in the process with a simple blood test. We can reach more people by taking the screening into their communities, just like we did, I might add, with breast cancer and HIV. And, we have mobile vans rolling into all those communities. You helped set up in Wilmington, Stacy, making sure we have a large African-American population who's underserved. We have mobile vans rolling in like in every one of your cities. As these techniques become more and more available and more precise, there's a lot we can do. Finally, we have to accelerate getting treatments to patients by identifying any unnecessary regulatory barriers that exist at the federal level that stand in the way of improving research or care. For example, patients should be able to seamlessly find a clinical trial that might suit a specific condition. Doctors should have an easy way of guiding their patients through the process. But less than, as you all know, 4% of cancer patients enroll in trials that might be key to discovering the next life-saving treatment. Now, I've been in Washington State, I've been in Nevada, I've been in California, I've been in Florida. I've been to, I think, 11 of the most highly funded and most reputable cancer research centers in the world. And they talk about how will they be able to get this life-saving capacity out to rural communities, Indian reservations. The one thing about you docs is, you became docs for a reason. You're devoted. You care. You care a heck of a lot. And it surprised me and pleased me to see how intensely the medical community is talking about the need to get services to at-risk communities that weren't available right now. Online clinical trial database has proven to be far too complicated for most patients and most local oncologists to be able to navigate. So under the moonshot, we're creating a new trials.cancer.gov to help people learn about and get access to cancer trials. It will also be, I hope, a significant benefit to the pharmaceutical companies who are conducting trials and many times have trouble finding enough people to be in the trials. As advanced as we are, the idea that we can't come up with an app that accurately and is able to be used, that has all this data on it, is surprising to me. You know, my son, and it's not about my son, this goes for everybody, just my personal experience. You know, we put in the Recovery Act, which the President asked me to manage, over almost $1 trillion, $840 billion we spend in 18 months. And by the way, with every outside study, less than 0.2% waste or fraud. And in that, we thought we were going to change the way we govern, and we decided that electronic record keeping would help the medical community a great deal. So we put $35 billion in. It all got spent. Guess what? The 5 systems can't talk to one another. I mean, think about it. Now, we're not computer scientists. My son Bo had allegedly he was in a trial of one, anti-PD-1 and a viral injected into a stage 4 glioblastoma, requiring him to, on a multiple times in the day, do an MRI to see the progress. At first, our docs were giddy at the progress that was being made. But he was up at Walter Reed, and the docs were down at MD Anderson, an incredible organization in my view. But for the fact my son-in-law is a leading surgeon in the Philadelphia area, we had to gather up the information, not record it electronically, get in a plane and fly it down. Joe, can you imagine your company functioning that way and being able to make it? It's not anybody's fault, but we got to fix it. We got to fix it. We owe it to future generations to seize this moment, to move with deliberate purpose and double our rate of progress by just dealing with things that, if this were a high-tech firm we were running, they'd say we got to solve this problem. It's within our wheelhouse to do these things. What I'm talking about so far doesn't even contemplate the enormous genius that resides in this room. Like one of the brightest men of all of medicine is the guy sitting right there who's the head of NIH. No, I mean it sincerely. The impediment isn't the lack of the gray matter genius and ingenuity in terms of new drugs, new treatments, etc. It's all this stuff that gets in the way. The only thing I'm good at in government is getting things out of the way. No, I am good at that. I am good at that. So, I don't want this to come across as somehow the federal government has the answer. We don't have the answers. We got to figure out how to get out of your way, and you guys have to figure out how to get in each other's way more. Previous generations have successfully faced similar problems and given us longer lives to enjoy today. Millions of people feared that their children during the polio epidemic in the 50s, but hope conquered fear sooner than anyone had ever imagined with technology and breakthroughs in the polio vaccine. Look at what you've all done in HIV/AIDS and how you've aggregated capability and the progress is made. Cancer is not going to be conquered by any one thing, but I believe it's a challenge. With your brilliance, we can win if we're devoted to winning it in a timely fashion, meaning yesterday. Today, we're announcing a series of measures being implemented by government agencies, private companies, universities, institutions, and foundations that address some of the problems and move us toward a goal of doubling that rate of progress. The federal task force has gotten to work and today is announcing a dozen new actions of policies, including the Department of Energy and Veterans Affairs, have now formed a collaboration to apply the most powerful computational assets at the national labs to nearly 500,000 veterans' records in one of the world's largest research cohorts, the Million Veteran Program, a cornerstone of the President's Precision Medicine Initiative. The National Institute of Health is launching a new partnership, bringing together 12 biopharmaceutical foundations and philanthropies to invest together to fund research to make all the resulting data available to everyone, ultimately bringing new therapies to patients in less time. Earlier this month, I went to the University of Chicago for the launch of the National Cancer Institute Genomic Data Commons, a platform that includes genomic data, associated clinical trials shared openly and broadly to advance cancer research and improve it. And we're announcing today that with the commitment from the Foundation Medicine, a total number of patients has gone from, when we announced, 32,000 patients have accumulated, doubled to 32,000 in just over a month. The expectation and hope is it will be exponential. Private, philanthropic, academic, patient advocacy communities have answered the call, including the Breast Cancer Research Foundation. Inspired by the moonshot, I'm told, call for a collaboration and commitment is doubling their annual research investment from $50 to $100 million, aiming for a cumulative investment of $1 billion by 2021 to speed up connecting the dots, as they say, between molecular information we can amass and our understanding of cancer, to accelerate turning new discoveries into effective treatments. Open, the Oncology Precision Network, a partnership between Intermountain Healthcare, Stanford Cancer Research Institute, Providence Health Services, Catholic Health Initiative, the Henry Ford Health System, and Synapses. I think I'm pronouncing it right, S-Y-N-A-P-S-E. It sounds like Synapses, but anyway, forgive me. But this network is going to link cancer genomic data for 79 hospitals and 800 clinics across 11 states. Data for more than 50,000 new cancer patients per year that can now be shared openly on a network. A company called DocGraph will use Medicare claims data released because of the administration's open data effort to publish reports describing Medicare patients, how they move through the healthcare system in years before and immediately after a cancer diagnosis. The report will show how factors such as geography, type of physicians and providers they see, their treatments, their pathways, affect the patient's experience and affect the outcomes. Through a collaboration with Destination Brands International and Mount Sinai Medical Center, the City of Miami Beach is providing dozens of free sunscreen dispensaries on their beaches, their parks, their public pools, for residents, for millions of visitors every year. I might add parenthetically, there's been no real progress in sunscreen, new sunscreen applications in, I don't know this for a fact, I think it's almost 2 decades. It's a long time. In response to Cancer Moonshot and the focus on prevention, Miami Beach is going to continue this program at least until 2021. These are just some examples. There are another 30 other announcements we're making today. In the early 1900s, a bone surgeon in New York named William Cooley, following pioneers like Koch and Pasteur and von Behring, developed a theory that most surgical infections, post-surgical infections, help patients recover better from cancer by provoking the immune system response. He began injecting patients with streptococcus and dead bacteria, which became known as Cooley's toxins. When he did, the patients survived a little bit longer. Following pioneers like Cooley, scientists today are developing immunotherapies that have a chance to make the threat of some cancers a distant memory. Imagine a day, perhaps when my grandchildren have children of their own, when the threat of cancer is a distant memory, when their children can be vaccinated for cancers as routinely as we vaccinate for measles and mumps, And other cancers can be treated and cured, made into chronic conditions. Folks, I've spent the better part of the last year trying to learn as much as I possibly can, to become as informed as I possibly can. And yet I'm not informed as many of you in the audience. I can tell you more about the PSI of an SS-18 Soviet silo missile than I can about some cancers. But I've worked hard. I've gotten a lot of help. And I think I'm in a position to say, without being totally naive, that we're on the cusp of breakthroughs that can get us there. The goal of the moonshot is to propel us forward today. Supporters and skeptics alike ask us, what's the moonshot? The moonshot is all of you, people listening in these all around the country, all of you jumping in, doing what you can to help prevent, change lifestyles, detect, treat cancer. It's everyone who spends nights and weekends in their labs looking for the next breakthrough. It's the patients who are being treated for their cancers, hoping they can return to their lives and their families. It's patients starting foundations and companies to develop cures for their children. It's organizations like NIH and the Department of Energy. And as small as Alex's lemonade stand, trying to understand cancer and help patients defeat it. The moonshot is carrying the hopes and dreams of millions of people who want us to succeed, make a difference in their lives and their families. Not someday, but now. The work we're doing and the work you're doing together, I think, can fulfill many of those hopes. Cancer touches everyone in some way. We all have reasons for being here. Survivors, patients, families, friends, physicians, researchers. But almost every one of us in here has lost someone relatively close to us. We're all here because we can do something about it. And that's what Jill and I decided to do when our son Bo passed. Part of the moonshot, as my view, from my perspective internally, is honoring the Bo, the life he lived with courage and never giving up hope. This isn't about him. It's not about a single person. It's about us. Not giving up hope and having the urgency of now. The urgency of now. I won't mention the particular agency, but we've had, one of the agencies in the federal government said they're going to get a new director and they'll have it by 2016, end of 2016. I called the head of that department in and I said, 2016? It is now June? If you can't get that director in the next 4 months, tell me. We'll go find someone else who can find them. It's bizarre. Some of your outfits are like that. We can do it later. Because these are breakthroughs that are just beyond our grasp. So we need each and every one of you. I challenge all of you to think anew about the scourge of cancer. Go beyond your comfort zone. Set and achieve goals that are going to change the way we do this. Think about it tomorrow. Look, I'll conclude by saying that I know I'm sometimes accused with total justification of being too passionate about the things I care a lot about. But when we were doing the Recovery Act, and I was in charge of making sure that my money got spent wisely, and I met with the cabinet 16 times. I met on the telephone for at least an hour with every single solitary governor but one, most every mayor in the country, and most every county executive. I mean, in large, from as few as 1 to as many as 80 at a time. And there was one program we had, I won't mention it, but we weren't able to get out X percentage of money, it was $28 billion, that would have an incredible positive impact on energy and on the consumption of energy. So I turned to the head of one of the departments, brilliant guy, and I said, why hadn't this been approved yet? And this person said, I have a 30-person department that has to go through it. I said, okay. And I turned to the other department that was involved, and I said, why hadn't this been done? He said, I have a 28-person department. I looked at my watch, and I said, well, it is now 11 after 10. And at the time, it was a Tuesday. If you guys don't have this settled by 11 after 10 on Thursday, I promise you I'm stripping those departments. Son of a gun. It was done, and well. It was well. Guys, some things you cannot rush. They take time. But some things, the only reason they're not happening, it's not we don't know how to do it. We're not urgently focusing on what has to be done. Finding a director, I promise you, if we lost a director, God forbid, of the CIA, I promise we'd have one very shortly. If we lost a general on the battlefield, I promise you we'd have one very shortly. So my plea with you is, and I know most of you are working, not a joke, I know most of you are working 17, 18 hours a day. Help me today be able to go back to the president and tell me what I should be doing, what we should be doing to increase the collaboration, expand the base of knowledge, and have a greater sense of urgency on the mechanical things, on the structural changes that make a difference. You're extremely gracious to put up with me. We need you badly, and I really do believe it's within your power to fundamentally change and turn despair into hope. Not cure everything, but turn despair into hope a lot sooner than later. Thank you for the bad news for you. I'm here the whole day. I'm participating in your roundtables. I wish you luck, and help educate me. I mean this sincerely. Help educate me is the best way to go about doing what we need to do. Thank you so very much.